This section of the 2024 survey focuses on child health, examining two critical pillars: immunization, which prevents disease, and the management of common childhood illnesses. Section 1. Immunization coverage. Full immunization. We begin with immunization, one of public health's most powerful tools. A child is considered fully immunized against basic antigens if they have received 1 dose of BCG, 1 dose of measles, rubella, 3 doses of DPT, hepatitis B, and Haemophilus influenza type B, and 3 doses of polio, excluding the birth dose. Childhood immunization. Among children aged 12 to 23 months, coverage for individual vaccines is generally high. BCG coverage is 97%. DPT, hepatitis B, and Haemophilus influenza type B, dose 1 is 97%, dose 2 is 93%, and dose 3 is 85%. For polio, dose 1 is 96%, dose 2 is 90%, and dose 3 is 74%. Measles rubella coverage is 88%. The critical measure is full immunization against all basic antigens. Nationally, 67% of children aged 12 to 23 months are fully immunized. Only 1% of children have received no vaccination at all. Immunization by region. Coverage shows some regional variation. The southern region at 68%, followed by the central region at 67%. And the northern region at 61%. The national average is 67%. Trends in immunization coverage. Looking at trends over time, the picture is mixed. The percentage of children receiving no vaccinations have dropped dramatically from 3% in 1992 to just 1% in 2024, a major achievement. However, full immunization coverage has fluctuated over time. 1992 MDHS 82% and 2024 MDHS 67%. Immunization by mother's education. A mother's education level has a clear positive correlation with her child's immunization status. Full immunization coverage by mother's education is: no education 53%, primary education 67%, secondary education 71%, and more than secondary education 71%. The gap between mothers with no education 53% and those with secondary or higher education 71% highlights where targeted outreach is needed most. Immunization by wealth. Interestingly, immunization coverage is remarkably equitable across wealth quintiles. Full immunization by wealth quintile is: lowest 66%, second 71%, the highest middle 70%, fourth 64%, and highest 64%. The wealthiest households have slightly lower coverage than the poorest. Human papillomavirus (HPV) immunization coverage. Among young women aged 15 to 17 by number of doses of HPV vaccine received, 42% have received no HPV vaccine, 26% have received 1 dose, 31% have received 2 doses, 1% don't know their vaccination status. Source of HPV immunizations. Among young women aged 15 to 17 who received any HPV immunizations by source, 89% received their HPV vaccine at school, 5% received it from a public health facility, 1% received it from private health facility, 1% received it from an NGO health facility, 4% received it from other sources. Section 2. Childhood illnesses and treatment. Acute respiratory infection (ARI). Moving from prevention to treatment, we look at common childhood illnesses. In the 2 weeks before the survey, 10% of children under 5 were ill with cough and rapid breathing, symptoms of acute respiratory infection or ARI. Encouragingly, for 70% of these children, advice or treatment was sought from a healthy facility or provider. Diarrhea. Diarrhea remains a prevalent threat. 22% of children under 5 had diarrhea in the 2-week recall period. Advice or treatment was sought from a healthy facility or provider for 64% of these cases, which, while substantial, is lower than the rate for ARI. Diarrhea prevalence by age. The prevalence of diarrhea varies dramatically by age. Among children under 5 with diarrhea in the 2 weeks before the survey, prevalence by age in months is under 6 months 11%, 6 to 11 months 44%, the highest, 12 to 23 months 36%, 24 to 35 months 20%, 36 to 47 months 13%, and 48 to 59 months 12%. Oral rehydration salts (ORS) treatment. The cornerstone of diarrhea treatment is oral rehydration salts or ORS. 53% of children under 5 who had diarrhea in the 2 weeks before the survey were given fluid from ORS packet or prepackaged ORS liquid. However, a concerning 20% received no treatment at all. Diarrhea treatment details. Looking at the full range of treatments provided to children with diarrhea: zinc 29%, ORS and zinc 23%, ORS and continued feeding 31%, ORS, zinc and continued feeding 14%. For oral rehydration therapy, ORS overall, ORS or increased fluids 61%, recommended home fluids RHF 13%, ORT, ORS recommended home fluids or increased fluids 65%, ORT and continued feeding 38%. Other treatments included antibiotic drugs 17%, antimotility drugs 2%, intravenous solution less than 1%, and home remedy or other 15%. Feeding practices during diarrhea. Proper nutrition during illness is vital. During diarrhea episodes, the amount of food given compared to usual was more 8%, same 25%, somewhat less 27%, much less 30%, none 5%, and never gave food 5%. For liquids given compared to usual, more 18%, same 26%, somewhat less 22%, much less 26%, and none 7%. Early Childhood Development Index. Beyond physical health, the survey also measures early childhood development. The index tracks whether children aged 24 to 59 months are developmentally on track in health, learning, and psychosocial well-being. Overall, 58% of children are developmentally on track. The results shows a gender gap with 61% of girls on track compared to 55% of boys. Key findings. To summarize the key findings: immunization coverage. 67% of children are fully immunized against all basic antigens. Only 1% have received no vaccination. Coverage varies by region, 61 to 68%, and mothers' education 53 to 71%, but is equitable across wealth levels. Illness burden. 10% of children had ARI symptoms and 22% had diarrhea in a 2-week period. Diarrhea peaks at 44% among children aged 6 to 11 months. Care seeking. Advice or treatment was sought for 70% of ARI cases and 64% of diarrhea cases. Treatment gaps. While 53% of children with diarrhea received ORS, 20% received no treatment, highlighting a crucial need for improved case management. Early childhood development. 58% of children aged 24 to 59 months are developmentally on track, with girls 61% outperforming boys 55%. This concludes Section 7 of the 2024 Malawi Demographic and Healthy Survey presentation on child health.